Hi everybody, this is Rich Sanders with Southern Health Lawyers, and this is the Health Law News Nugget for February 20th, 2018. Our Health Law News Nugget is intended for hospital administrators, physicians and physician practice managers, pharmaceutical executives, and anybody who has an interest in what's going on with the politics and business of healthcare. The news this week comes to us from the Center for Medicare and Medicaid Services, which issued on February 14th, last week, a national health expenditure projection covering the next 8 years. So CMS said, we've looked at all the data, all the demographics, and we project over the next 8 years until 2026 some really interesting numbers. Whether you're an investor in healthcare or a participant as a provider or other kind of economic interest in healthcare, the news is all good from CMS. Ultimately, healthcare is expected to grow 5.6% over that term and ultimately add $5.7 trillion to the American economy. That's important for a couple of reasons. First of all, as an investor or a participant in healthcare, that means that business is going to be good. And second, that projection, according to CMS, is based on what it describes as fundamentals. There are certain things that are changing in America that we can't control. Specifically, the baby boomers are aging and becoming Medicare enroll eligible every single day, and that's going to lead specifically to the increase in Medicare enrollment. It's also going to affect Medicaid. The economy is strong right now. The projection for spending is going to continue to increase according to CMS, and so Medicaid enrollment is likewise going to increase, not because people are going to become more Medicaid eligible because of their impoverished status, but the number of aged and disabled Americans will likewise continue to grow and add to the population of Medicaid enrollees around the United States. So good news from CMS last week in terms of the strength of healthcare as an overall part of the economy and how that will impact federal spending. Please stay tuned to our channel and watch for next week's Health Law News Nugget. Thanks a lot.